We designed the titanium implants for patients 20 years ago, patients who have problems with their soft tissue in the nose, which means whenever something is collapsing, for instance, the internal nasal valve, where we put it on top. That is the initial design, to put it on top of the upper lateral cartilages to stabilize that part so it will not be collapsing with inspiration. But we learned over the years, and for the last 6 years, we have been using it also on the lateral part of the nose to stabilize the lateral part, the so-called external nasal valve with titanium batten grafts, as well as in the septum to straighten and strengthen the nasal septum when this is crooked or unstable. Titanium is the one metal in the body that is tolerated the best. We know that for many years. I mean, all the dental implants are made of titanium. Also, we have seen that in the nose it is very safe in terms of infection. We have almost no infection there. We have had no implant coming through the nose in these 19 years that we have been using it. And we have had very few cases, 2 patients out of my 1,500 patients who had an allergic reaction of the skin where we had to remove it. But overall, the long-term stability is excellent. We have numbers of 98.5% of stability over long term.
My experience with titanium implants is very clear. I have inserted these implants in specific patients with internal and external valve dysfunction, and actually they worked quite well. Initially I had some concerns about the safety, the long-term safety, as well as the efficacy. But in the end, my patients in whom I implanted those titanium implants, and those experiences date from 10 years ago, is actually very positive. So nowadays I tend to consider titanium implants as an alternative for cartilage that I may have to harvest either from the ear or from the rib.
I see my patients now that have operated 19 years back, and they come for other reasons, whatever they have, infections or ear problems, and they repeatedly tell me the surgery with the titanium implant was the best surgeries they had in their lifetime, which means they are so happy in long term that they can breathe and that the airway is open and stable. This really works long term. Absolutely. In fact, even though we've been using it for almost 20 years, we still have to convince colleagues all around the world that this is safe and stable to use. So the initial designs are now implemented more and more in various countries around the world, but we are also designing new implants. For instance, one clip that we put on the septal cartilage directly, the septum clip, that is in preparation, that should be hopefully on the market by this late summer or next winter 23.